The aorta is the largest blood vessel in the body. An abdominal aortic aneurysm, or AAA, affects the segment of the aorta that runs through the abdomen. AAA is common in older adults, and there appears to be a genetic link because this type of aneurysm tends to run in families. And people who smoke cigarettes are more likely to die from a ruptured abdominal aortic aneurysm than non-smokers. Abdominal aortic aneurysms usually occur in people with atherosclerosis, also known as hardening of the arteries. As the arteries harden, the wall of the aorta is damaged and weakened. The pressure of the blood flow inside the aorta causes the weakened wall to bulge outward. High blood pressure also contributes to weakened aortic walls. The rupture of an abdominal aortic aneurysm is now the 14th leading cause of death in the United States. It is estimated that 1.5 million people over the age of 60 have a AAA. In fact, once an abdominal aortic aneurysm has ruptured, 25% of patients die before reaching the hospital, with an overall operative mortality approaching 50%. But here's the good news. This condition can be identified in minutes with a painless ultrasound. The technologist will visualize the aorta vessel and take several measurements. If an aneurysm is present, the technologist will be able to see it very quickly. A normal aorta is about 2 centimeters, so anything over 3 centimeters is considered an aneurysm. An aneurysm that is over 5 centimeters will be considered dangerous, and surgery will most likely be required at this point. Known as the silent killer due to its typically asymptomatic development, the AAA often goes undiagnosed, leaving the patient vulnerable to a catastrophic, potentially lethal rupture.